Okay, so then type 2 diabetes risk factors. So many things. So increased age. So again, this is why the old term for type 1 diabetes mellitus was juvenile diabetes, because like, in type 2 diabetes mellitus, this tends to people, the older we get, the more our risk increases for type 2 diabetes mellitus. And genetics. This is why like especially, well, you most of you are probably too young to be screened for this, but often physicians will ask you, do you have family history of type 2 diabetes mellitus? So things that, and other thing that can affect are genetics. So things like, if depending on where your ancestry came from, some populations, they have genes that predispose them to a higher risk of type 2 diabetes. Then yeah, so here we have African American, Alaska Native, American Indian, all above average risk and yeah, Asian American, Hispanic, Latino, the Native Hawaiian, Pacific Islander. Jeez, isn't that like most of the population in Hawaii? But they all have like a above average risk of type 2 diabetes mellitus compared to the general American population. So again, and there's the thing is that there are many genes, and this is why there's so much research being done into type 2 diabetes mellitus. You saw all those little blobs with arrows? Sometimes little changes, like the things, those little proteins and enzymes, they're not the same in everybody. They can differ between different populations depending on your genes. Doesn't mean one is better than the other, but sometimes like just small changes in the enzymatic activity can lead to development of resistance or due to different conditions. And there are many genes involved. That's why it's a really complex puzzle, and why there's a lot of diabetes research being done. And then cardiovascular disease. So the other interesting thing is that type 2 diabetes mellitus and cardiovascular disease is almost like there's another term called the metabolic syndrome, and it involves not only like type 2 diabetes, it also involves like heart disease, it also involves obesity. So all of these things kind of like, the thing is that having one of these predisposes you to other conditions, really, yeah, to other health conditions as well. So is it related to changes in diet from the ancestral countries? Yeah, so that's the interesting thing about human populations is like, okay, we kind of like over thousands of years, we probably developed like, hey, do we metabolize certain things in our diet better? That's one possible cause. Like the Asian flush, they found out like, oh, maybe it has to deal with like metabolizing alcohol, and maybe if things were fermented, this was like a warning sign too. So that's another classic example of some different enzyme allele or enzyme variant happening in certain populations. But again, and socioeconomic status, that's another thing that can affect too. Is like when we talk about like things like nutrients and like what we call food deserts, like which is easier to eat? Is it which is more expensive? Is it to eat organic all the time, or get the dollar menu at McDonald's? I mean, it's like if you don't have like a place that has a supply chain with fresh foods with low fat and like and that have a lot of nutrition, well, where are you gonna go? To a place that you can afford, right? So yeah, it's a very interesting thing. I think we have to leave it to top hat or like pack back, because that's a lot of stuff. Like it's very complicated. That's what I'm getting at here, is that many risk factors. So things like cardiovascular disease. So if you have like heart disease, you're more likely to develop type 2 diabetes mellitus, and also sedentary, which I think everyone increased during the lockdowns and pandemic, and obesity. This is a big risk factor for type 2 diabetes mellitus.